Yeah, let's run through chapter 14. And what chapter 14 is, 14, 15, and 16 all deal with your immune system, and particularly 16 deals with reactions with your immune system, but 14 and 15 are more or less how your immune system is going to function. 14 is more your non-specific defenses, so talking about your first line of defense, second line of defense. 15 discusses your third line of defense a little bit more, some of your specific immunity. But beginning of chapter 14 really takes a look at all three collectively. So starting off, talking about what your immune system is. Your immune system is made up of many substances within your body. It is going to be your defense mechanism against infection, okay, from a variety of microbes. When you look at your lines of defense, we can say that we have 3 lines of defense to protect us. Now, when you look at these, line number 1 and line number 2, they are non-specific. By that, I mean they can fight off anything. Okay, any type of an invader they'll work on. You can even look at particles, allergens, anything. Okay, so something foreign. Line 3 is where you have your specific immune response. Okay, so you have HIV antibodies working against the HIV antigen. Okay, a specific type of a response. That's the difference between lines 1 and 2. In lines 3 is going to be the specificity. This is just how your immune system functions overall. Okay, so there's something foreign present. Your immune system cells are like, all right, we got to get that foreign invader. Okay, let's destroy it and prevent infection. So first and second lines of defense, again, they are non-specific. They are innate. That means they're part of you. Okay, so encompassed within your body, part of you already. First line of defense is so easily overlooked because it's very basic. It's just having intact skin. It's having mucus along the mucous membranes, cilia along the respiratory tract, any anatomical features which are going to help to prevent microbes from infecting you, prevent microbes from gaining access into your body. Maintaining a slightly acidic pH on the skin, in the vagina, in the stomach, okay, that's going to help to ward off infection. Normal flora, having all of those organisms present, within your body, on your body, to fight off invaders. It's very easily overlooked, your basic first line of defense. Works very well for a number of us. If you look at burn patients, that first line of defense is compromised. Okay, that skin barrier is compromised. They will be vulnerable to a number of infections due to that, compromising of that first line. Difference between first line and second line. Second line is going to involve a number of immune system cells. Okay, so here we're going to look at, white blood cells and some of their products. Antimicrobial proteins like interferon or complement, if you've heard of complement or interferon. If not, we'll discuss them. That's at the end of chapter 14 today. Your body's inflammatory response, everything that goes on with infection and inflammation. That's all second line of defense. When you have the inflammatory response, no matter what the agent is, it's not specific. Same thing with fever. Phagocytosis, again, is ingestion and destruction of a microbe. These are non-specific types of responses. Where if you look at acquired and specific, okay, this is your third line of defense. What you have with your third line of defense is a specificity. We have 5 types of white blood cells. Okay, 5 main types. Yes, we have derivatives of them, but we have 5 main types of white blood cells. One of those 5 are your lymphocytes. Your lymphocytes, you have your T lymphocytes and your B lymphocytes. Okay, so T cells and B cells. They have specific immunity. That means they specifically respond to a particular microbe. Very, very specific. T cells do a lot of direct killing. B cells make plasma cells that make antibodies. Okay, so B cells associated with antibodies, T cells direct cell killing. We'll explore a little more of that in chapter number 15. We'll talk about it again today. This flowchart is fantastic. This is the beginning of chapter 14, so I highly recommend you check this out. But it really breaks down, okay, first line, second line are your non-specific lines, lets you know what they encompass. Okay, we covered this already, but we're gonna go through everything here in pink. Okay, we're gonna cover today. We'll also cover a little bit of this today. And then specific immunity, that's your third line of defense. Okay, so you can have active or passive third line of defense immunity, and active would be gaining that immunity due to having the infection. Okay, so specific antibodies, passive, of course, maternal antibodies that are received from your mother. All right, first line of defense. Again, very easily overlooked when you look at the first line of defense. It's your skin barriers, these surface barriers, acidic pH, cilia, and so on. And again, they block anything living. Okay, so as you can see, I didn't make this picture, but as you can see, I just grabbed it off the internet, but as you can see right here, these are just organisms that have set up shop. The green guys are the good guys. As long as they're there hanging out, that purple guy's got nowhere to go. So you have your good bacteria hanging out. Something harmful comes along, it's got nowhere to bind to. All right, so we are going to talk about all three of these, anatomical, chemical, and genetic. So first, let's talk about these anatomical barriers. This is going to be a nice little review of anatomy, which everyone had, prior to coming to this class. So looking at anatomical barriers, first you have your skin. Okay, so having intact skin is definitely going to help to prevent infection. Again, you can think of a burn patient or think of someone that has an open wound. Okay, they are definitely much more susceptible to an infection because this is, their skin is compromised. Okay, that's an easy way for organisms to gain entry. If you look at the skin, you have a protein in your skin, okay, within the epidermis, these superficial layers, which is known as what? What is the name of that waterproof protein?
Keratin.
Keratin. Okay, so you have this keratin within your skin. That's going to help to prevent microbes from binding. Okay, so that's good. Looking along the skin, you have hair, which is also going to help to kind of sweep away microbes. And you have different glands, oil glands, sweat glands, even earwax glands. Okay, producing these substances helps to wash away and sweep away microbes. Okay, so very simple, easily overlooked, but again, any compromising with these anatomical barriers, you're more susceptible. This is just a recap of all the first line. We haven't talked about them all yet. We've just talked about like sweat, for example, or having intact skin, but we can also see having cilia along the respiratory tract, chemicals within your tears and saliva, mucus all along the GI tract, different enzymes, urination. Mucous membranes. So mucous membranes, you do have a layer of mucus, of course, along the mucous membranes. The mucus is going to help to prevent organisms from getting through it and invading, but yet it's kind of difficult because organisms are more prone to attach to moist surfaces compared to dry. Your skin would be considered a dry surface, where mucous membrane would be considered a moist surface, so they kind of favor the moist areas. You don't see the keratin layer, of course, with mucous membranes. You see that layer of mucus. We know epithelial tissue, those cells, are replaced very often. Okay, you're looking at like skin, for example, those deeper layers. It takes about 32 days for them to rise to the surface. So you always have the sloughing off of skin, which helps to prevent entry as well. Digestive tract. Okay, so having your saliva, there is a chemical within your saliva. This chemical is also within your tears. Okay, this chemical is called lysozyme. I have it written right down here. Okay, so lysozyme, it has an antimicrobial property. Lysozyme can actually dissolve, hydrolyze, break down the peptidoglycan layer within bacteria within their cell walls. Okay, so it can help to break down bacterial cell walls. That's in our saliva. So that helps. I mean, that's a little antimicrobial property that's part of us that we have. Does it prevent all infection? Absolutely not. Does it help? Yes, because we are consuming, and there's so many microbes, being placed into our mouth all day long. Okay, so having this antimicrobial property there, this chemical, is definitely beneficial. Also looking at the digestive tract, what's going on in the stomach? What's the pH of the stomach? Approximately 2. It's very low. It's very acidic. So having a very acidic, environment is going to help to kill a lot of microbes that you are going to swallow, throughout the day. Of course, looking at reflexes, up here I put vomit in parentheses. Okay, so here is going to be a reflex to eliminate a lot of these, pathogens if they are present. Okay, your body reflexively wants to eliminate them. Okay, so vomiting or passing them through, looking at diarrhea, getting rid of them as fast as you can. No water is getting absorbed into your body, so your feces is very watery because your body's just flushing them out very fast. Okay, so we're going to eliminate them. Urinary, physical removal. Okay, so looking at urination throughout the day, any organisms that may land and maybe start to migrate, up the urinary tract, so up the, urethra, for example. The frequent urination is going to help to flush them out. Let's see, respiratory. So if you look at the respiratory tract, you're going to have cilia all along that respiratory tract. So down the trachea, for example, down to the lungs. It sets up a really nice, cilia escalator. Little cilia are hanging out, they're moving, so they're going to keep mucus traveling up the trachea, up towards the throat, and then you swallow that mucus throughout the day. And any particles that you breathe in get trapped in the mucus and the cilia, and they're moving along, and they're going to keep those particles coming up. You'll swallow them, get rid of them. The cilia does an awesome job at helping to prevent infection. If you look at smokers, for example, so if anyone smokes, you look at the cilia, and the smoke actually paralyzes the cilia. So now the cilia are doing this. Okay, they're not moving, they're just kind of hanging out there. So then the particles, a lot of the mucus can build up, get trapped down in the lungs. Much easier for bacteria to initiate infection because you don't have the cilia helping to constantly have this escalator bringing them up. And then of course, smokers cough, developing just to physically, get rid of this mucus and a lot of these particles. So that does a really nice job. Looking at the eye, so blinking, and what is lacrimation? Tears, tear production. So you look at your lacrimal glands that are hanging out up here, okay, of your eye, okay, on the lateral side, and tears get released and they sweep across your eye, okay, lateral to medial, of course, and that's just going to help, almost like your windshield wipers, how they work. Okay, so just releasing the tears and blinking, just kind of flushing anything that may land. So definitely that is beneficial, plus that chemical lysozyme, which is present to help kill. So here we can see the cilia, respiratory tract. You're going to have this, escalator constantly going on, and then you'll just swallow the microbes out of the stomach, get destroyed, or cough them up, or sneezing reflex. Again, just ejecting microbes as they may land, harmful pathogens. Chemically speaking, so looking at pH levels varying throughout the body. With pH, there's a few areas of the body that are on the acidic side. We know the stomach, extremely acidic. Skin and the vagina more on the slightly acidic side. Your skin is just slightly acidic. But the fact that it's slightly acidic and not right at neutral also helps to prevent microorganisms from growing. Okay, so keeping these areas of the body on that acidic side definitely is beneficial. Okay. You guys should know the pH scale by now. So as you go down from 7, you get more and more acidic. What did I miss up here? Again, tears and saliva have that lysozyme. What is a sebaceous secretion? Oil. Okay, so these oily secretions. You also have sudoriferous secretions, sweat, which is going to help. Eyelid glands, so again, releasing that lysozyme. Genetic barriers. Genetics plays a good role with how your body functions. It's not everything, of course, but it does play a role with it. We know that if there is a mutation, a lot of mutations are bad, okay? They're detrimental. There are some mutations every once in a while when they happen, it's actually beneficial. If an individual has a mutation and now they don't have that certain marker, that certain receptor on a cell that a virus needs to bind, that person can be just genetically just immune to that particular virus. Okay, so that is something possible. Also malaria, I think we talked about this earlier in the semester with sickle cell. This is a really nice picture right here to kind of illustrate this point a little bit. With sickle cell anemia and also with malaria, individuals that contain the traits, the gene, just one allele for sickle cell anemia, they will be immune to malaria. So if you look at how this table is set up, here we're seeing this individual, okay, green on both sides, means that is a sickle cell trait. They have the trait, they're expressing that disease, this individual, sickle cell anemia, so survival rates, of course you're looking at the cross here, surviving to a reproductive state. Okay, so again, questionable here with that. On this side, these individuals normal, okay, so both normal, do not have the sickle cell trait, they do not have sickle cell anemia. That means they are susceptible, 100% susceptible to malaria. In a place where malaria is endemic, like West Africa, it's really hard to avoid. Okay, so you look at families having multiple children, maybe only able to afford one mosquito net. Which child sleeps under that mosquito net? Who doesn't is going to be susceptible. So here, looking at surviving to reproductive age again, okay, here we're seeing the cross. In this scenario, here you're looking at just carrying the trait for sickle cell anemia, but not expressing sickle cell anemia. That's going to make these individuals immune to malaria. They don't have sickle cell, they can't get malaria. This is the way to go in West Africa, which is why you see so many cases of sickle cell anemia in West Africa compared to other places in the world, because just having that trait makes them immune to malaria. Malaria is rampant there. For us, we don't see super high numbers because having that trait doesn't give us any benefit like it would over there. Okay, so genetics definitely plays a role. Let's do a concept check for your first line. All right, so your skin produces which protein to create a waterproof barrier?
Keratin.
Keratin, yep. Keratin is the name of that protein that we see with the epidermis. All right, a thick layer of what in the nasal and respiratory passages helps to trap bacteria? Mucus. Yep, so having that mucus along those mucous membranes. Tears and saliva contain blank that hydrolyzes the peptidoglycan of bacterial cell walls. Lysozyme. Yes, the name of that chemical is lysozyme. It can break down the PG layer, dissolve it. All right, so low pH in the blank prevents the growth of microbes. So two places in around the body that have a lower than neutral pH, have an acidic pH.
Stomach and vagina.
Stomach, vagina. What's the third one we talked about? Skin. All right, true or false? Some pathogens are able to circumvent the physical and chemical barriers of the first line of defense. True. If that was false, okay, we would never come down with infections. So yeah, so they are able, some pathogens can get past these very basic first line defenses. All right, second and third line of defense, we'll kind of start talking about them together. Because when you talk about the immune system, you're really talking about the second and third line. First line is so basic, it's just simple. Your skin, just having acidic pH, cilia, very basic. But your immune system encompasses second and third line. So this is really what is meant by immunology. These are all the white blood cells and cell products that all go along with protecting your body. Okay, lines 2 and lines 3. So immunology, again, really is a study of the second and third line. And if you think about how your immune system works, you can really sum it up in 3 words. Search, recognize, destroy. Your immune system, these cells are constantly doing surveillance on your body. They are roaming throughout your body, checking everything out. So they are searching, doing surveillance. Recognize means they are recognizing what belongs, what doesn't belong. This cell belongs, this cell belongs, this cell belongs. This cell doesn't belong. Okay, and then the last thing is destroy. So when they find something that doesn't belong, that's when an immune system response is mounted and destruction of this organism takes place. Search, recognize, destroy. Constantly, 24/7, taking place in your body to protect you by your immune system. Okay, so non-specific, second line, specific, third line, working together to protect your body and to prevent infection. Okay, so your white blood cells, which are also known as leukocytes, okay, are involved with this process. And we are going to talk about all the types of white blood cells today. So this is just showing surveillance. Okay, white blood cells circulated throughout your body, checking out everything. Over here, this picture, you can see red blood cells. Here's a white blood cell hanging out amongst the red blood cells. Red blood cells completely outnumber white blood cells, of course. So here we see one hanging out. They're much bigger than red blood cells. So if we take a look, okay, so what's going to happen are these white blood cells, they're going to scan everything. And what they look for is called a marker. Okay, so they look for markers. A marker is some type of a characteristic that you see on a foreign cell, or on any cell, I should say, not just foreign. Okay, so they're looking at these markers. Now, on a foreign cell, what they're really looking for, is referred to as a PAMP, which is a PAMP. Probably want to write this down. So we're looking at PAMPs. What a PAMP is a pathogen associated molecular pattern. Okay, so it's a PAMP. So these foreign cells have these PAMPs, and your immune system sees them, and that's when a response is going to be mounted. Okay, so that's associated with pathogens. So all host cells have, these characteristics, these markers. All cells have characteristics and markers. Easiest analogy I can give you would be facial characteristics with us. Okay, so Carly. So if Carly gets up, walks out of the room, comes back in, you'll look and be like, oh, that's Carly. She belongs in this room. Not think twice about it, right? Because you saw her facial characteristics, you recognize her as Carly. If some person that's not in this class walked in this room and sat right here, everyone would be like, I don't recognize them, who's that? Okay, what you're looking at are facial characteristics. Your immune system does that 24/7. They're looking at every single cell, looking at markers, belongs, 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 doesn't belong, and if it doesn't belong, that's when a response happens. Okay, so they do not attack or respond to host cells, just like students in this room, great, no big deal walking in the room. Okay, so they would recognize non-self markers like a PAMP on something foreign, and that's when the immune system response takes place. They'll attack and respond to that microbe. Phagocytosis, very common event. Again, here's the bacteria, here's the white blood cell, recognizes it as foreign, engulfs it, kills it. Here's just another picture showing what we just talked about. White blood cells, checking out self cells. Self cells belong, okay? Those are not foreign. Checking them all out. Doesn't do anything to them. Okay, here's your white blood cell, checking everything out. Great. Down here, here's a foreign cell. Okay, Okay, PAMP, we know what a PAMP is, pathogen-associated patterns. Okay, your white blood cell sees this and is like, hey, this is foreign, so he's going to engulf it, break it down, destroy it. Okay, so you can see the difference between self and non-self and the response by your immune system. Here's a little video that kind of sums up some of the stuff we talked about and gives us an idea of where we're going to go with this chapter. So let me play this for you.
Hit the little wheel on the bottom, you can just turn those off.
Trillions of microbes ready to invade our bodies lurk in the air, the water, the foods we eat, and on the objects we touch. Nevertheless, most of us are healthy most of the time and unaware of the constant battle between body and microbe. Even when infections occur, we almost always fend them off quickly. Our usual state of good health is due to 3 lines of defense: external barriers that keep microbes out of the body, nonspecific internal defenses that combat all invading microbes, and our immune system, which assaults specific microbes. The body's first defense against microbes are the skin and the mucous membranes of the digestive and respiratory tracts. The dry, dead cells, filled with hard proteins that cover the outer surface of the skin, prevent most microbes landing on the skin from obtaining needed water and nutrients, while acids and natural antibiotics secreted by the sweat and sebaceous glands actively inhibit the growth of bacteria and fungi on the skin. The membranes of the digestive and respiratory tract are protected by mucus, which contains antibacterial enzymes that destroy the cell walls of bacteria and physically traps microbes that enter the body through the nose or mouth. Cilia on the membranes sweep up the mucus, microbes and all, until it is either coughed up, sneezed, or swallowed. Swallowed microbes enter the stomach, where they encounter a combination of extreme acidity and protein-digesting enzymes that kills many microbes. Farther along the digestive tract, bacteria harmless to humans secrete substances deadly to other invading bacteria or fungi. Though these defenses are good, the warm, moist mucous membranes are more vulnerable to invasion than the skin. Disease organisms that enter the body through the skin or mucous membranes run into 3 nonspecific internal defenses: standing armies of phagocytic and natural killer cells, the inflammatory response, and fever.
Okay, so pretty good video, and we'll talk about the inflammatory response and fever today. What we need to talk about now is just a really quick review of different systems that are incorporated into what's known as your immune system. A lot of this should be basic review from an anatomy class, that you've had prior to microbiology. And it's important to note that with the immune system, it's not like one set system where you can easily identify various structures. It's a lot of different body systems put together, which is going to make up, your immune system. So again, they're going to be integrated, work together to give us the maximum amount of protection against these invaders. Here we can see how we can have this connection between different structures. So here we're looking at blood capillaries. We can see this arrow. This is a bidirectional arrow. So that means substances can go into the bloodstream, substances can leave the bloodstream into a tissue space. Here's a tissue space. You can see a lot of reticular connective tissue. Reticular connective tissue has these reticular fibers, kind of like a lattice, kind of like a fishing net setup. It's going to be really good at trapping bacteria. If you think about a fishing net and trapping a fish, so it's trapping the bacteria. And then within reticular connective tissue, you have a lot of white blood cells hanging out, and something gets trapped, they're there to capture it. Okay, so really good system. Here we see lymphatic capillary. With the lymphatic capillary, they're unidirectional passageways. These lymph vessels are unidirectional. That means substances travel one direction only. Here we see materials can go into the lymphatic system, into the lymphatic capillary, into the vessel, but not out within a tissue space. That's important to note. Okay, so here we can see substances that get trapped within this tissue space can either enter the bloodstream or into the lymphatic system. Most of the time we see them entering into this lymphatic system where we have, this high concentration of these immune cells, and we have these little bean-shaped structures throughout the system known as lymph nodes, which we can have a lot of destruction capacity within these lymph nodes. So first up, the first system we have is called the mononuclear phagocyte system. Okay, kind of wordy for this system. All that it is referred to as a system that just kind of connects the cells within these tissues to each other. It's really kind of all about connection and communication, okay, between these cells. Lots and lots of macrophages. Okay, so we have 5 types of white blood cells. One of the 5 types is a monocyte. Macrophages are derived from monocytes. Okay, same line. Just kind of keep that in mind. We'll talk about it later, but just in case you're wondering what a macrophage is, they're phagocytic cells. They have the capacity to ingest a lot of material. Macro, what does macro mean?
Big-ish.
Large, okay, they're really big, okay, these macrophages, and they can ingest a lot. They're like gigantic garbage disposals. So they're hanging out ready to attack. And then, we can see these various structures all along the system integrated with the lymphatic system, like the thymus gland, your lymph nodes, GALT and MALT. Has anyone ever heard of GALT? It stands for gut-associated lymphatic tissue. So any lymphatic tissue associated with the gut is just put into this category of GALT. Gut associated. You might have like Peyer's patches, these little patches along the intestines. It's part of GALT. MALT, the M stands for mucus or mucoid associated. Okay, your tonsils, of course, your spleen. Appendix would be, tossed in there. Okay, so here you can see greater concentration of phagocytic cells in these regions of the body. So here you can see kind of like, the core of the body itself. We'll do a nice little review of the lymphatic system. I'll just kind of highlight a few features of it. I'm certain everybody's had, this at some point already. So looking at this system, we see the lymphatic system does mirror the cardiovascular system as far as the vessels, same location, they're going to kind of follow suit. There's a big difference between the cardiovascular system and the lymphatic system in the sense that how is blood pumped with the cardiovascular system? How is blood moved around? The heart. Okay, so the heart's going to pump and it's going to push the blood around, do pressure, yeah. Okay, now as far as the lymphatic system, how is the fluid in the lymphatic system moved around? Movement. Okay, so moving your arms, okay, moving your body. Basically, it's kind of like the squeezing or the milking of skeletal muscle contractions that will move the lymph through the system. Breathing. Okay, just think about it. Chest expanding like so. It's almost like kind of this milking action. So you have this muscular contractions. And the lymphatic system is just another, you can think about it as another passageway outside of the bloodstream where we can do a lot of killing of microbes. Okay, lots of infections broken down within this system. Okay, bloodstream, yes, carrying oxygen, CO2, to the tissues, away from the tissues, great. You're gonna have a lot of killing going on within the lymphatic system, within these lymph nodes. So it kind of gives that auxiliary route for those processes. Okay, so here you can see what you find along the system, lymphocytes. Okay, so your B cells, your T cells, your specific immune response, lymphatic fluid, which is just called lymph. It's just like the plasma in your blood. Phagocytic cells, okay, also looking at antibodies that get produced. Just a picture showing circulatory system, lymphatic system, and then how they're integrated together. If you look at this last picture, so here we can see the heart acting as a pump to pump blood throughout the body, and then lymphatic system. If you look at this, one-way flow. We get one-way flow. Back up, technically it goes back up to the subclavian vein where the lymph gets reintroduced back into the bloodstream. Okay, lymph is just like plasma, very, very similar to plasma, which is a watery component of the blood. This picture right here, or this video right here, there's no narration, just some soothing music you can listen to while watching the lymph flow through the system. But here you can see within a tissue space, okay, some particles get trapped. Okay, here you can see substances can come out of the blood. Okay, pick up these particles, go into the lymphatic system. It's going to be a one-way flow. So one-way flow passing through lymph nodes along the way. Okay, where a number of these agents can be broken down within these lymph nodes. Afferently leading in, efferently leading out. There you can see that they have some methods to ensure one-way flow. Just looking at valves all along the, and then it's going to get reintroduced into the bloodstream at the subclavian vein, which should be blue in that picture, that animation. But you have the valves just to ensure one-way flow, so lymph can't go backwards. Okay, just like you see in your veins. Okay, same thing. So you see that fluid, which is just like plasma, referred to as lymph, flowing through. So again, what we see, water, proteins, electrolytes hanging out. The vessels, one-way flow, very, very low pressure, and like Anna mentioned, it's going to be muscular contractions. Skeletal muscle contractions, which are going to, push this lymph in the direction it needs to go. Okay, so return back to the blood through the thoracic duct or right lymphatic duct right into the subclavian veins, okay, near the heart. Lymph nodes, little bean-like structures, look like little beans, and here is kind of a nice isolated area where a lot of obstruction can take place. So some infections, when the lymph nodes are inflamed and enlarged, you can tell an infection is going on. It'll be tender to the touch, like in the neck region is a common place. Axillary region, armpit area, groin area, very common indications for clusters of these lymph nodes. There's a lot of filtering and nice environment for immune reactions. This picture here, you can see a normal lymph node. Okay, so here's one in the neck in the cervical region, and then you can see red and enlarged and inflamed when there's a lot of destruction going on. There's an infection going on, active infection. This little clip is just a short little, I think like 1 minute segment from the show Monsters Inside Me. Has anybody ever seen that show?
Show's creepy.
Really good. It's crazy, like all the different parasites that exist, some of the stuff I've never even heard of, and it's insane. But this one's really good because this one just talks about a particular infection which is characterized by a sign, okay, that a patient would have an extremely enlarged lymph node. Okay, we're talking extremely enlarged, quite painful. So let's just take a look at this. And it's actually named after the fact that the patient would have this enlarged lymph node.
New Mexico residents John Tull and Lucinda Marker have become seriously ill on a trip to New York City. After finding swollen lymph nodes on Lucinda's groin area, their doctor comes to a startling conclusion.
He said, "This is what you have, a bubo." I didn't know what he was talking about.
A bubo? is a telltale sign of a frightening condition.
There was really only one possible diagnosis this could be, and it was the dreaded bubonic plague.
The bubonic plague is caused by deadly bacteria called Yersinia pestis. Inside both John and Lucinda's bodies, the plague bacteria invade the lymph nodes, causing them to swell. These are called buboes. If the bacteria get into the bloodstream, they clog the arteries, often ending in death.
The bubonic plague is highly contagious. The first reported plague pandemic was in the 6th century of the Common Era, and it has killed well over 150 million people worldwide. Without treatment, the bubonic plague kills 50% of those infected.
Okay, it's kind of interesting to know that term bubo, refers to that, super enlarged lymph node, and the bubonic plague is named after the fact of the bubo. Okay, a couple more things, and then we need to talk about blood. So checking out the spleen. Spleen works as a really nice blood filter, but also is another location where these immune reactions can take place. So an individual that has their spleen removed, for example, so an asplenic individual, of course, can still survive, but their immune system would be slightly compromised because they lose this, ability to, fight off some infections. It's important to know where the spleen's at. It's one of those organs, probably like the least well-known organ of where it's at in your body. Okay, so definitely see here, it's in the upper, left quadrant of the body on the lateral side of the stomach. You can see right there. Other types of lymphatic tissue, we talked about galt, malt already. The appendix as well, just clusters of lymphatic tissue. Tonsils, these Peyer's patches, this is what they look like along the intestine. It looks abnormal, but they're little pockets of, immune tissue. All right, blood. So I'm just gonna do all this on the board. Let's just do this on the board. Let's raise this up and we'll do some writing. Okay, here's a tube. All right, so let's say you go to the doctor, right, and they take some blood, which is like my least favorite thing to do in the entire world. So I'm horribly afraid of needles. Like my hands are sweating thinking about it. But okay, so let's say you go and you give some blood, and what's going to happen is when you place it in the tube, there's going to be a lot of anticoagulant, proteins along the side of the tubes, wasn't, coagulate or clot during transport. But they'll put it into some machine, which is called a centrifuge, which spins really, really fast. So anything heavy gets pulled down to the bottom, anything super light goes up on top. So when all is said and done, we're going to see something that looks like this. And draw this out. So down here, this region. Here we have this nice little middle area, which is green. And then we have this area up here, which I did not draw these to scale whatsoever. This area up here is what we would refer to as the plasma. Okay, up here at the top. Plasma, you're looking at 55%, okay, of the blood. And we're just looking at just normal hematocrit when we're looking at this. But 55% right here in the middle, this is what we would call the buffy coat. Buffy coat is less than 1%. And then down here at the bottom, okay, red blood cells, 45% of the sample. Okay, so now what's another term for red blood cells? Erythrocytes, okay. So erythrocytes, red blood cells, make up 45% of the sample. Buffy coat, and then we have our watery component known as the plasma. Within the buffy coat, this is where we're gonna find the white blood cells. And platelets are hanging out within this buffy coat. Less than 1% of the sample, so looking at numbers, definitely red blood cells completely outnumber white blood cells, even platelets. So what I want to talk about here, and white blood cells, of course, known as leukocytes, platelets, known as thrombocytes, is let's just explore plasma a little bit. You know, it's a watery component of blood. What do we find in plasma?
Protein.
Okay, we find some protein.
Salt.
Yeah, we find some, I'll just put other things, and then the main thing we find is water. Percentages, over 90% is water. I'm going to say 92. Protein, let's say 90% water. Whatever. 90 or more. 8% protein, let's just say like 2% other. I think that's fine. Looking at this, so you have mostly water. As far as protein is concerned, we have a few different types of protein. Other things, like Anna just mentioned, salts, we'll say electrolytes, we'll say hormones, okay, things like that are in the other. As far as protein, most predominant protein that is found is something called albumin, which is going to help just kind of regulate, you know, the concentration, osmotic properties of the blood. There's another protein that we find in plasma. Your B cells make them. Antibodies, so albumin, antibodies. What's the other word for antibodies? Starts with an I. You have IgA, IgD, immunoglobulins. Yep. So antibodies, also known as immunoglobulins, so you have IgA, you have IgG, IgM, IgE, and IgD. You have 5 varieties of these immunoglobulins. Okay, so albumin antibodies, what am I missing? Here's what I'm missing. Let's say fibrinogen and other clotting factors. Okay, that's all hanging out in the protein components of your blood, okay, of your plasma. Now, so if I were to ask you guys, is there something out there?
No, it looks like it's gonna rain.
Really?
Looks like it's gonna.
It's
thunderstorm.
also supposed
We were just talking about it, and I left my windows down.
to be like 102 by the time we're out of class.
Well, that's why I left them down.
Yeah, that wind picked up.
It's tornado.
Okay. So
Yeah, your truck's gonna get a little wet.
it's windy, so. So looking at plasma versus serum, there's a big difference between plasma and serum. So if you were to go in for any type of like immune testing, you know, they're going to utilize your serum. Now, how do you get serum from plasma? What's the difference? Well, if you allow this sample to clot on its own, okay, so it clots on its own, so all the fibrinogen, the other clotting factors, thrombin, all that stuff, pull down, causes red blood cells to clot. So basically, the liquid that remains afterwards is going to be what we would call plasma. I'm sorry, oh my gosh, is what we would call serum. Okay, so what remains is called serum. So we'll say serum serum equals plasma minus clotting factors. Okay, so serum is, I'll just circle everything that's in serum. That is serum. These are in plasma only. Okay, that is the difference between plasma and serum. No clotting factors in serum. Why is that beneficial when you're doing any type of immune testing? Why? If you're doing, let's just say, okay, one of the tests we're going to do in this class, we're going to do an ELISA. Enzyme-linked immunosorbent assay. We're going to do this test for HIV detection. When you run this test, almost like, okay, let's use the example of like blood typing. Okay, when you do blood typing, what are you looking for? Like when you're in front of you, clotting. You're looking for clotting. When we do the enzyme-linked immunosorbent assay, we are looking for clotting. Okay, so you don't want any false clotting going on. So if you were to use plasma, you're going to have these clotting factors which may interfere with the test. If you use serum, you don't have the clotting factors, so if anything clots, that's your results. Okay, so that's why we use serum with immune testing. So keep that in mind. I'm gonna put some, since I have the screen up, I'm just gonna kind of take advantage of it. And I'm gonna just talk to you guys about white blood cells. Okay, so we have 5 types of white blood cells. We have what we would call, we have neutrophils, we have eosinophils, and we have basophils. Neutrophils, eosinophils, and basophils are 3 of them. These 3 we would call granulocytes because they have little tiny cytoplasmic granules inside of them. Okay, so we would call them granulocytes. And then we have monocytes and lymphocytes. These 2 categories are referred to as A granular cytes. It has the letter A in the front of the term, that means without. So they do not have these little tiny cytoplasmic granules. If you were to look at a picture of a neutrophil, it would look something like this. Almost looks like headphones as the nucleus, and then it has all these little granules inside of it. You would see the same granules for these guys. If you look at the A granulocytes, you would typically see just a very large nucleus inside without those little granules. They might have little tiny ones, but not like these guys. What do the granules do? Depends on the function of the white blood cell. Neutrophils are very active phagocytes. Phagocytosis, again, is ingestion and destruction of bacteria. So these little granules oftentimes are digestive enzymes. Okay, so they're going to digest and destroy something foreign. Functions of eosinophils. These guys work with inflammation and allergy, as do basophils. However, eosinophils have one extra property. They are active with eukaryotic infections. Easy way to remember it, eosinophils start with an E, so does the word eukaryotic. What is an example of a eukaryotic infection? Parasite. Yep, so looking at a parasitic worm, looking at a fungus, a protozoa. Okay, so any of those, you'll see higher numbers of eosinophils. So like for allergy, you might see the little granules or like histamine, for example. Over here, we have monocytes. I will tell you that monocytes, they are called monocytes when they are in the blood. And then they are referred to as macrophages when they are in a tissue. So they leave the blood, they go into a tissue, now they're known as a macrophage. Is there anything else really different about them? No. Okay. They are, again, active phagocytes. As are monocytes, both active phagocytes. These guys are very popular at the end of an infection. They kind of clean up the mess from an infection. You know, all that residual pus and all that stuff from inflammation, they're going to come along and clean it all up. Lymphocytes, again, we have our B cells and our T cells. B cells make plasma cells, which make antibodies or immunoglobulins. Where your T cells is just, you're looking at direct cell killing. Okay, so I think it's a pretty good look at, the white blood cells. One more thing I want to mention is there is a certain concentration of them that we find in the bloodstream. It's in order. Okay, does anybody recall, from an anatomy class or maybe if you read through the text already, which of these 5 types is found in the highest concentration within the bloodstream? Neutrophils. Yeah, neutrophils are first. I'm just going to put a 1 here. You can list them in order if you want. Actually, I'll just do that up here. So we have neutrophils, and they're really found at 65% of your white blood cells, you're looking at neutrophils. Very high percentage. Which one comes next? Something from the
Lymphocytes.
Lymphocytes come next. So next are your lymphocytes. And they're 25% or so, 25 to 30%. These are second. Next.
Basophils. Or eosinophils.
We actually have monocytes. Next, go. I think they're roughly 5%. I'm not quite recall. I think roughly 5%. And then we have eosinophils, and then basophils. Eosinophils, I think they're roughly 2 to 3%. It's very, very low. And then basophils, they are less than 1%. So very small for basophils. So these are just approximate, but that's the order. There's a mnemonic to help you remember the order. Okay, it is never let monkeys eat bananas. So if you just remember that sentence, never let monkeys eat bananas, you got the first letter of each.